July.
All right. Well, first of all, good morning, everyone. Again, I know for those of you who have been looking at my page this morning, it seems like you just saw my face because you did, because we had we had a conversation for virtual office hours. I believe it not only is important, but I also believe that during this time we need to make sure we're helping people to the full extent possible, because that's what this time calls for. Right now, give you an update of where we stand on cases. Currently now, worldwide, there are 1.9 million cases in the U.S. We have 547,000 cases. And in Florida, we have 21,000 cases. As it pertains to each county, in Broward County, we have 3,177 cases. And in Miami-Dade County, we have 7,000 cases. We are in a true epidemic that we as a state need to take seriously. And my hope is that we're taking it seriously. We're continuously to practice social distancing. We're staying in the house. I saw the video. I don't know if you all seen it. Yessenia and Danielle from Pensacola, where all these individuals were out gathering for Easter. You know, we can't do that. If we're going.
Yeah, we can't. Unfortunately,
you saw it, Danielle?
We can't do it.
Yeah, before this spread anymore, we have to be responsible. And I know you want to see your families and friends. I know you miss a lot of people, but right about now, the best thing we can do is stay in the house. Today, I will have the perfect opportunity to have one individual who I've known since 2011. We've known each other for a long time, and that's Yessenia. And then we have Danielle, who I've known for about 3 years now. And let me tell you something. We have a responsibility to ensure that no one is left behind in this conversation when we're dealing with who do we help during this time. And it's extremely important that we help every person that's vulnerable within our communities during this time. So today we have the opportunity to talk with two frontline individuals who are big in the area of advocating for people with disabilities. And before we even go into what they're going to talk about, I want them to share with you their experience and introduce themselves to you so you all know who they are. Yessenia, we'll start with you first.
Okay. Hi, everyone, and thank you for this opportunity. Against Yessenia Leyva. I, first and foremost, am an advocate for individuals with disabilities. My goal is to connect people to the services, information, and resources that will help them become independent to the best of their ability, without so much seeing their disability, but what they can do. And my passion for that comes from my own experience, as I was born with spina bifida. So for me, it's a been there, done that kind of deal. So I feel like I understand how to get the services. I know what it's like not to have services or not to have benefits, not being able to work. So that's why I'm very passionate about it. And more so in times like these, where I always say we don't know what we don't know. So I cannot penalize someone or vice versa for not knowing something. So here we are to bring light to our environment and what's going on today, and in hopes that we can work together to improve and make sure that, like we say, no one is left behind.
Thank you, Yessenia. I really appreciate that. I like what you said, that not seeing people's disabilities, but seeing their abilities and what they can do. That's important. Danielle?
My name is Danielle McGill, and I'm the advocacy coordinator at Ann Stork Center. I have cerebral palsy myself, so I know what it's like growing up with a disability and having to be as independent as possible, and to what needs to be done as far as services go and what services help us to become independent. as far as jobs, as far as transportation, as far as health. All those components, along with our support systems, help us get to where we want to be in life. And during this time of isolation and self-quarantine and not being able to be with our families, for some of us with disabilities, because we're either in group homes or at a different care facility that helps us become independent, I find that people with disabilities are having problems with handling those type of scenarios through this crisis. How do they communicate with their families? How do they go about their day knowing that they're still being productive or progressing with their abilities? So that my focus for this is to bring the voice of families, to bring the voice of the individual, and to remind employers and support systems out there that inclusion is possible. We're seeing it happen on a global scale and as well as a state and local level scale. And we need to continue that movement even after this pandemic. So
Thank you
that's
so
what I
much,
gotta
Danielle.
say.
I really appreciate that, and I really thank you both for your advocacy and being so brave. Because where people, and I'm gonna go back to what Yesenia just said, where people might see your disability, you all have shown what your abilities are, and fighting on the front lines for people. So I really appreciate that. I do want to kick it off with just one thing before we get to the presentation that you all are going to give. There is an ask from some parents who have children at home, and they want to know if you all can, in your presentation, include any online programs and helpful tips for parents of children diagnosed with educational, intellectual, and behavioral disabilities.
Sure.
Yes, we have resources in our presentation that could help assist them. We linked to agencies like Access Living. We have a health passport portal. We have information about COVID-19 pertaining to people with disabilities. And they have many links to telecommunication, to accessibility, to everyday routines and self-care. It's a whole gamma. So, yeah.
All right, so maybe we should hop into the presentation?
Yes.
Let's do it. All right, so let me share. And there's a question from the media. Samantha Gross from the Miami Herald, I won't get this out now. There's a Samantha Gross from the media asks, can someone touch on how the coronavirus has affected care for people on the APD, iBudget waivers, and other APD services? Has it affected services like home care and other types of necessary care?
Absolutely. For one, up until this point, work in an adult day training center as the employment specialist and care support in the day program. It has affected in many ways. For one, because of the contamination and the keeping distance from one another, there's countless number of nurses, companions, direct care staff that no longer go see these clients because of what's going on right now. So what that means is that these individuals, one, are no longer receiving services. Two, they are not being included in anything and they're just home, secluded, and going through everything that we go against, if you will, when it comes to APD services. Adult day trainings are not open. We're not open. We haven't been open for at least 3 weeks or so. So that means anxiety, depression, more health-related, disability-related issues that arise from this, psychological difficulties, etc. The budget for the APD providers is at stake because, if anyone is familiar, we go by the number of income that comes in is based on the number of students or, young adults or whatnot that come into the adult day training program or the service that we provide. So at this point, there is no income because there's no service being provided. So the effect that the coronavirus has on adult day training programs and APD in general as a whole is very difficult.
Yeah, and when everybody is being laid off or becoming unemployed, their eligibility to receive crisis goes up, it increases, making the funds decrease
Right.
in the amount of money that the state is able to provide, because everybody will be on a crisis tier level. So it's very important that we try to get these services back and running for people with disabilities. And from my agency standpoint, we're having difficulty getting supplies that we need for our individuals in intermediate care facilities that provide 24-hour care for these individuals. And Yessie and I both agree on this. It's not that our caregivers and PCAs and nurses don't want to come into the homes to help these individuals. It's the fact that they're afraid that they may be asymptomatic, or they may fear of bringing the virus to the individual. So it's not that they choose not to come to work. They want to. It's just that this virus is so, with the social distancing, it's really hard for them to make the decision. Should I risk my person that I'm taking care of day to day, or should I stay home? So it's a catch-22.
And when we hear the at-risk, you know, we're constantly hearing the terms that many may think do not include the people with disabilities, because we don't actually hear the term people with disabilities, but we are high risk. We have low immunes. We're asymptomatic. I can have any bacteria or infection in my body and not even know it. So, you know, that's the biggest thing when it comes to those that are homebound, or that they don't have nutrition and food. How are they getting that? How are they getting their medication if they're fully dependent on a nurse to do so for them?
And you're right, because I'm getting messages from a number of constituents who they're not receiving home health services because of the pandemic, which is unheard of. And we're going to talk more about this. Should I start the go ahead and do the thing?
Yes. Please.
Okay. 1 second. Let me share.
Thank you so much, Representative Jones.
No, thank you. Let me pull up the PDF. Hold on. Let me see. Take it away, Whitney. Technology works when we want to, right?
Yeah.
There we go. All right. So whoever you all can definitely please take it away.
Well, we could go to slide number 4 on COVID-19 and disability. And as you know,
Okay.
as you know, that there are 9 million Americans that are at risk and that are vulnerable to this virus. We all know that 1 in 5 people have either an intellectual disability, a developmental disability, a mental health, physical, sensory, or other disability. We know how we could acquire it, and we could also be born with it. So this virus, when we say pre-existing conditions in the media, we're also saying disabilities, even though they won't, the media does not say individuals with disabilities fall into this category. And that's another thing too. We need our leaders, we need our state reps, we need our local officials to spell that out, so that we know, so our constituents know that we're included, that we're not forgotten, and that families know that our leaders are taking it seriously when it comes to us and our well-being as well. Don't you agree, Yessie?
Yes, and it all comes down to the verbiage. We don't want to offend, right? We feel like there's so many different terms being used today: disability, different ability, special needs, you know, and we want to be politically correct, which is great, and it's appreciated. But I think that as people with disabilities ourselves, we have to be conscious of the fact that it's about educating the community first, and our leaders and our representatives, and our representatives and everyone to meet us halfway and want to learn and show interest in doing so. And we would be more than willing to work together to do that. So I agree, and I believe that the verbiage and the representation in that sense is very important.
Ms. Crow?
Yes.
So, yes, the issues that impact us are very simple. Healthcare and testing. We need access to healthcare and testing because people with disabilities, unfortunately, some of us don't have the ability to use transportation during this time to go out and get tested if we feel like we have symptoms, or, you know, so we need to know what we can do to make that possible. Switching to telework, switching to remote employment is a big thing for me because it took 30 years of the ADA to get these kind of self-accommodations for people with disabilities. And now because of this virus, we see clearly that employers are able to make accommodations for people with disabilities on the job. So after this pandemic, I hope that employers continue giving people with disabilities the opportunity to work remotely or at office or both. So real inclusion could happen. And I know Yessie is big on inclusion, and she could tell you a little bit more from her perspective on that.
It's huge. I cannot tell you also as a job coach how much I hear that, you know, when employers are not.
Oh, yes, he just paused.
Okay, well, like I said before,
Leave the home.
Oh, she's there.
So it's a lot of things that limit their ability to go to work. A lot of times they need modification when it comes to communications devices. So many different things, or maybe it's assistive technology, a laptop or something for which they literally can't leave. And I wanted to touch a little bit when it comes to the transportation. For example, now with the coronavirus, one, if not the only transportation method that exists for people with disabilities that cannot drive is Broward County TOPS transportation, the BTT bus. And in Miami-Dade is the
STS.
STS, yes, thank you. And so right now, only one individual is allowed to be in the van with a driver. So you literally have hundreds, if not thousands of individuals with disabilities in Broward County. I'm gonna speak for Broward County, and only one per TOPS transportation is able to be on there right now. On a regular basis, it's not much different.
Because it's a share ride system, and Broward County Transit is taking the protocols. I want to make that clear. They are taking the protocols needed to keep the individuals safe.
Yeah.
But then again, there's a fear of using the service right now because of the virus and how it is spread to each person. So you're taking a risk by using these transportation options. So
is there a way, what can we do? What can I do? Because I know there's some people who are watching outside of the media. There are other people who are in leadership work with the county, what can we do to advocate to ensure that persons with disabilities are receiving these services from the county when it comes to transportation during this time?
Well, you gotta talk to our community transportation coordinators, the CEO of TOPS. I don't want to mention names, but they are taking the proper protocols. I want to say that you are safe, but it comes down to the drivers. It comes down to how clean the vehicle is before and after use. If we could implement those procedures and policies more, how they handle our equipment, because think about it this way. When a driver's touching our mobility equipment, like for instance, my walker, are they wiping down after they touched it? Because then I have to use my walker when I get off the bus. So that right there is cross-contamination. So we need to think like that when it comes to this virus. Are they using the proper cleaning equipment? Are they using the right products on these buses so they could protect their drivers as well as us? So it's very important. If you could help with that, I mean, that's a
I know, and I apologize
itself.
because the Wi-Fi is coming in and out a little bit for me, so I apologize if I miss something. I wanted to add that is very, and when it comes to TOPS transportation and STS, and for our drivers, you know, for the higher ups, and then going down to our drivers, and that is crucial because of what everything Danielle just mentioned, as well as the drivers.
And sensitivity during this time is very important. Driver sensitivity training is very important in this time.
They're not doing a lot of them. Some of them are really, really amazing. And so I personally have offered TOPS transportation to do a training for disability etiquette training, and I have been denied.
Danielle, have you
taken care of?
Yes, I know your Wi-Fi is going in and out, but when you say you've been denied to do the trainings, you've been denied because of, for what reason? Has it been through TOPS or has it been through the county?
I know what she's speaking on because my agency has offered driver training. We have a program called Mobility Management Facilitation Program where our agency comes out and trains the drivers. We are trained to train the drivers, and we have gone to the local coordinating board on this issue, and time again they have denied our participation and our willingness to help. It's free of charge from FDOT. I don't see the reason why they wouldn't take up a free service for their drivers. But like I said, this isn't about just transportation. This is about COVID-19. And I really would like to focus more on that. But as far as transportation goes, I think the hygiene of the drivers, as well as the individuals, as well as taking care of those buses and making sure they're clean is very essential to stopping the spread.
Perfect. Thank you. I really appreciate you for
That's
sharing
what they could do now. That's what they could do right now. The training could wait after the pandemic, but for now, I think the hygiene part is the most important part.
It's the most important. Okay.
And Chef, to answer your question, I have been denied from the county, from the higher.
Okay, we're gonna move on to the new.
As mentioned, they already They already have their contract training company that provides this training for them. However, mandatory for all drivers.
Okay. Okay, thank you, Yessie.
Unfortunately, we're talking about a new normal for the able-bodied person as well as for people with disabilities, but unfortunately, this is not a new normal for people with disabilities. I strongly want this to be heard. What I'm about to say is because we have faced isolation throughout history. People with disabilities, we've been institutionalized. We've had the lack of access to healthcare, the lack of access to transportation, to employment. So during these times, we actually know how to survive with limited resources, with government benefits. We actually know how to survive something like this. Because we live it day to day. We're still unfortunately excluded. So it kind of, this is not new to us, but it's new to our able-bodied peers. So it's like they're getting to feel what we feel on a daily basis now. If that makes sense.
It makes perfect sense.
And really quick also on the previous slide regarding telecommunication. I think that is very important to touch on if we can for a moment.
Go ahead, please.
In regards to telecommunications, we cannot forget that a lot of individuals with disabilities communicate differently. And a lot of times we're under the assumption that because we know sign language, because we're deaf and hard of hearing, we know sign language. So just because you're deaf doesn't mean that you know sign language. So we really got to be mindful on how we can work as a community in all aspects to make sure that we're fully inclusive.
Yeah, like providing interpreters during press conferences and updates.
It's right? There's no updates for individuals with disabilities that might need that. And so if there's a question of, okay, well, how do we make that happen? You know, we have to think that we have to be accessible with regard to the communication.
Yeah, because we see it at the national level that they have interpreters, but we don't see it on the local level. We see it on the state and the federal level, but we don't see it on the local level.
So so your suggestion would be to ensure that we are accommodating everyone in our updates. So that means individuals who for sign language, like you just said, Yessie, captions.
Yes.
Okay, understood. And I know a lot of people, even with these updates, a lot of people, even myself, and I think the fact that you're bringing this out, that's why this is so important. The fact that you're bringing this out is extremely important, that we, that especially leaders in the community who are being informed, that, like we said, bring everyone along, that no one is being left out of this.
Absolutely, and that's where inclusion comes in.
Yes.
Absolutely.
Yes.
So,
you know, and if we don't know, then we can all, work together to make sure it happens. But
like having things in plain language, material to read that is understandable to a person's level of understanding, not so much government words. Having simplicity is sometimes better for individuals with disabilities. Having pictures, having captions, having the braille available for this information that comes out is very important, so that we get all aspects of what we're trying to accomplish. So
Thank you, Danielle. All right, we go to the
next slide.
Yep, gotcha. There we go. Resources.
And here's some resources that family and caregivers could use for their loved ones. Access Living has what we talked about with accessibility and telecommunications. COVID-19 facts and figures and stuff pertaining to people with disabilities. Then we have self-advocacy information from StarTAC. They have a plain language guide on COVID-19 for your person, for your individual and family that explains it at their level and pace. And then the third resource is a health passport that Florida Developmental Disabilities Council gave out through the National Developmental Disabilities Councils throughout the country. So this passport will help doctors if you do have symptoms and if you do go to the hospital. It tells you what to check off so that they know what your symptoms are before you get to the hospital. So it's very important, and to also have a health segregant because there's fear currently on the federal level and on the nationwide level that that they're rationing care for people with disabilities, taking away ventilators from people with disabilities and using it for everybody else in the hospital, which is understandable. But then again, if people with disabilities need these ventilators 24/7, they should not be taking away their only source of getting the proper care that they need day to day. So parents are very scared of that. And agencies like the ARC, Save Empowered, Disability Rights, they came up with a petition to help their doctors learn the proper procedures and policies for people with disabilities when they have to enter into the hospital. So it's very important that we understand that every life is valuable during this pandemic.
I totally agree with that. That last part, Danielle, is what I wanted to touch on is we have to, you know, as a community, it's so important to give the value necessary and the value that is deserved to people with disabilities. Let's not undervalue any life because all lives matter, right? And just because you have an underlying medical condition, a disability, doesn't mean your life is worth any less than anybody else's life. So I would really encourage us and anyone that has that power to help us educate the medical professionals, the professionals in adult day training programs, caregivers, everybody. You know, a person with a disability is not a dollar sign. They're a human, and our life matters.
And Representative Jones,
I appreciate. Go ahead, Daniel.
Representative Jones, I've provided the information to your legislative aide.
Okay.
Of the health passport, so you could share with your constituents as well as what I'm talking about with the rationing of the ventilators.
Yes.
I think it's important for our state officials to know what the feds are doing so that they can help advocate for us and our families on this issue.
Yeah, and I really appreciate you for sharing that with Jessica. And you have, when I said you have a lot of people who are watching this, you have different local elected officials. You have school board member Robin Barterman is watching. You got Vice Mayor Brian Johnson is watching. You have other people who are on here who I know for a fact who I can coalesce with to make sure that we're providing like a lot of the services that you all are asking for, that you all have people who are advocating for a lot of these things that you all are bringing up, which I greatly appreciate, which is very helpful. I went to the next slide for you all.
And our last slide is about stopping the spread, what they could do when they're out in the general public, or if they need to stay home, what they could do at home. Cleaning frequently the counters. If you leave your house and you go to a grocery store, or what to do when you get back, to make sure that you clean the bags, you take off your masks, you put them in the wash, or even take a shower to prevent it. for people with disabilities, we have to take the extra precautions. So it's like intensified by 100 more times. I know some families that have individuals with Down syndrome, and they have secondary conditions, and they're scared of bringing home the virus to their loved ones because it's life or death for us. And even with cerebral palsy, if for example, and Yessie knows this, if you get this virus, you could develop pneumonia, and people with cerebral palsy are not as mobile as the everyday able-bodied person. So it's more intensified, and they don't say that to the families and individuals with disabilities out in the open in the media or stuff like that. It's like we're forgotten, even though we know. It would be nice for our leaders to acknowledge that we also are vulnerable to this pandemic as well. So I hope all this information is helpful for you and for everyone watching.
It is.
And I think this was great. And also, I'm very big on the therapies and the education that all of our students receive, particularly those with disabilities. In a regular education setting, we already have difficulties ensuring that just because we have any kind of disability doesn't mean we have a learning disability, and going into the special education classes and all that good stuff. But now just imagine those are supposed to be receiving occupational and physical therapies that only get those therapies in the school system. Now we're seeing that those individuals are getting those minimal therapies, which is just 30 minutes or so during their school time, during the day. Now they're getting that at home, if any. Now the parents are the ones getting those therapies. So that is something very crucial that's going on. We're going to see a lot of regression. We're going to see a lot of, again, that depression in those individuals because they don't understand. Why are we not going to school, Mom? What's going on? And when this pandemic started, I'm going to be honest with you guys, I was depressed in the beginning because I was thinking, not about me. I'm okay. My home is okay. I'm thinking about my students. Yeah. They're calling me that they're getting in trouble. They're calling the police on them. They're having behavior issues, and that was really getting to me. So
yes, can I ask you a question? Not to cut you off, but I want to go back to as far as how it's being responded to these issues when it comes to law enforcement. How are law enforcement responding to these individuals with disabilities who you're speaking of, are your students?
Oh boy, we need a lot of training in law enforcement. As a whole, we're treating these individuals just like anybody else because the lack of education on autism, on behavior, on aggression, but not aggression in a violent way, just aggression because of your behavior that comes along with it.
The behaviors come out more when there's stress and when there's a crisis, and our law enforcement, our first responders are not ill-equipped to handle this kind of situation with people with disabilities. They need more training, more understanding, because what they see in the able-bodied person is not what they're going to see in a person with a disability.
Right.
So,
and now in this time, depending on the disability, a lot of those individuals don't understand why they're home, why they can't go outside, why their routine has been, switched around. And now it is a new life that we are living and that we're going to continue to live for a long time, unfortunately. So we need, again, everybody as a whole in the community, including our law enforcement and paramedics, to be trained in how to work with these individuals. We
want to say they're doing the best they can with what they have.
Yeah.
And they're trying to keep us safe, and they're trying to keep themselves safe and their family safe. As leaders, maybe you guys could have some training put in place for something of this magnitude in the future.
And it could literally be as simple as, how do you speak to them? What do you say? What don't you say? What words do you use? So literally nothing in the physical sense, but more of, how do you talk to somebody to make them feel, like they are what they are, which is a human being, and you're seeing the human first and the disability second, getting at their level while calming them down, and then moving forward with the situation at the time.
And you have, so there's some individuals, and so I won't go to, because we have about 8 minutes, about 10 minutes left. There's some questions that have come up. One person, Lita Rodriguez Wells, is my sister-in-law, but she thank you all for doing this. She said it's extremely helpful, and she responded to your last comment and making it clear that that children and parents are calling them every day looking for help. If you all have a lot of people watching, so if you have parents who want to reach out to you all just to get some advice or some resources, what is your email address where they can do it?
On the last slide, our email addresses are there.
Oh, okay, I'll share it.
Yes, please do.
And I'll share it on the live.
On the live feed.
Yeah.
Okay, there's a question that came. Steve said, just do a YouTube search for autism police watch and what can happen all too common. Remember North Miami Beach when a therapist was shot protecting his client with autism. I remember that case.
Yeah.
Miami Beach with the individual with autism dealing with the law enforcement. Damien Gregory, Damien, it's good to see you on Facebook. Damien is amazing. You should follow him on Facebook. I met Damien in Tallahassee. He came to my office. He did give some great information. So he said that if you're having problems with testing or other related issues, you can contact Disability Rights Florida. And he did put the email, the website there, which is disabilityrightsflorida.org. He also made mention that Miami-Dade has testing in-home testing for COVID-19, and appointments will be available starting at 9 a.m. Monday. And he put that information in the Facebook Live also. So they are doing in-home testing for COVID-19. And that number is 305-499-8767. That's 305-499-8767. And this is for those of you who live in Miami-Dade County. They're doing in-home testing.
Representative Jones, it came to me how individuals with disabilities may need help being transported to these facilities, testing facilities. So maybe this is something that you could do with the mayor and with Broward County Transit, is to have TOPS and STS work together to bring people to these testing sites, so that they don't have to make it more cross-county lines, so they don't have to wait at transfer points during this time, that they use each other's resources to get them to where they need to go if they need to be tested. And Yessie and I were talking about this earlier, about that article that you just read about providing testing for homebound people. I think that's a very good idea, and hopefully Broward County will do the same.
I'm happy. I just that Gregory just shared that, because I'm going to check with Broward. I know Broward has mobile testing sites. I don't know if they have started doing in-home testing, but I will verify that. Let me tell you all something. This has been, Yessie, I'm so happy you reached out to me to do this, because not only is it important, but it's also needed. And again, I cannot, and you all are getting great shout outs from people, from just you sharing your stories, sharing the resources that's needed. So I really thank both of you. But we can't end without doing what's known as a hope message. What is your hope message that you want to give? There's so much going on out in the world, and I just been asking everyone to give a hope message to people. So we'll start with you, Danielle.
My hope message would be that inclusion is possible during this time, through kindness, through understanding, through patience with each other. Every person in your community has a part to play in this, and to allow the person that you are helping to know that they are not alone and that their voice is heard means a big deal to this population. And what we're doing is we're bringing some light to this situation and shining light so that our leaders could help us through this ordeal. And God is with us all the way. Whether you believe in God or not, there is someone watching over us through this. So
I believe that.
thank you for
sharing that,
having
Danielle.
me today.
Thank you. I appreciate you for sharing that. Yessie, what's your hope message?
Thank you. Thank you for this opportunity. Thank you for responding so quickly when I reached out. I was excited. And it's because of people like you that we are able to spread the message and feel like we're supported. So I really appreciate that. And you've always been that way. So thank you. My message is, yes, we're in a time where we feel as people with disabilities the way we feel all the time, coronavirus or not, but don't do life alone. Reach out to people on the phone, on the internet. There's still ways of communication. Reach out to somebody that you trust and know that you have somebody to talk to, because that'll make things a little bit easier. You know, if you're a faith, a person of faith, regardless of what you believe in, stick to that faith and use it to help you move forward, and know that this is not permanent. It's temporary, and we're all here to support one another. So don't do life alone. Be aware of those resources and that information that is out there. There is information out there. There's people like Danielle, myself, and so many others that will help you obtain and be informed of what is out there.
And there's many organizations out there too, like Disability Rights Florida, the ARCs.
You don't know what you don't know, but if you don't ask questions and you don't find out, you know, you're not gonna know. So reach out to us, know what's out there, have faith, believe, and don't do life alone.
Well, I really appreciate you both. And I want to end this the way I started it, Yessie, on something that you said. You said that don't look at us as people with disability, as someone with a disability. Look at our abilities and what we're capable of doing. I think that is a very important message, and I'm grateful for both of you, and I really appreciate you both advocacy. This post will be permanent. You did have the media taking; they were listening, so I know that your message will reach the masses because they're going to get that word out. Keep fighting, and you, as always, will have a fighter in me. Your issues are my issues, and I will.
Thank you, Representative Jones.
I appreciate you. Thank you. Your issues are my issues, and you have my word that I will advocate on your behalf. Okay.
Thank you.
Thank you.
Thank you.
Thank you so much. Take care.